perform hand hygiene using the alcohol hand rub provided. Introduce yourself to the patient with a friendly greeting, maintain steady eye contact, and obtain their consent to examine them. Ensure that the patient is comfortably positioned and adequately exposed for the exam. For example, for a cardiovascular exam, position the patient in the cardiac position with the head of the bed elevated to 45 degrees. For a gastrointestinal exam, ensure the patient is lying flat on a pillow with the abdomen fully exposed. Also, position yourself on the right side of the bed to optimize your examination technique and maintain a professional stance. Throughout the exam, be careful to avoid causing any pain or discomfort to the patient and provide clear, concise instructions for each maneuver. As you perform your exam, periodically look at the patient to check on their comfort and response. In the case of a neurological exam, which often requires numerous instructions and complex maneuvers, practice is key so that your necessary instructions become second nature. Speak to the patient throughout the examination, explaining what you are doing in a natural conversational manner without resorting to a detailed commentary, so as to mimic real-life clinical practice. Now let's recap using the mnemonic HPEP H, hand hygiene. Perform hand hygiene immediately upon entering the room. P, patient. Focus on the patient by introducing yourself, obtaining permission, and maintaining attentive engagement throughout the exam. E, exposure. Ensure the patient is properly exposed for this examination. P, position. Confirm that both the patient's and your own positions are optimized for the exam. For example, the patient in the cardiac position and you on the right side of the bed. Finally, always conclude by thanking the patient for their participation. This approach not only demonstrates your clinical competence, but also reinforces patient-centered care, leaving a positive impression on both the patient and the examiners.